Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral otitis externa, and I will continue with the procedure in a moment, but before I do, I just want to take this opportunity to introduce to you our recently developed clear wax WAXscope. For anyone who's interested to learn more about the WAXscope, you can either visit our Clear Wax YouTube channel, the link is in the description, or wait till the end of the video and I've got a 5-minute clip showing you how the WAXscope is used, how it's held, the different instruments that can be used in tandem with the WAXscope, and all of its functionality. So stay tuned till the end of the video, guys, if you are interested in that. So going back to this patient, they suffer from chronic otitis externa. So otitis externa is an umbrella term given to an infection or inflammation of the outer ear, and they have to have their ears cleaned every 6 months. And you can just see the skin, it's very tender, it's macerated. And what we're removing is a combination of discharge because of their otitis externa, but also an ointment the patient has been prescribed by ENT to use on a regular basis. Now, unfortunately, the ointment can gather in their ears. So every time they use the ointment, it's going to add another lacquer, and it then builds up, can eventually clog the ear. So they do need to have their ears clean on a regular basis. The reason why we're using a Jobson horn in this ear is because we were able to insert that safely into the ear without making contact with the bony part of the ear canal. But this patient also suffers from tinnitus, and wherever possible, I want to minimize exposure to the microsuction probe, which can be a bit noisy. Now, if you have tinnitus, it doesn't mean that you can't have microsuction. But this patient's tinnitus is quite severe, and if possible, whenever it's possible, actually, it's not just in cases of patients with tinnitus, if there's an opportunity for me to try and remove earwax or discharge in this case using mechanical instruments, then I will always try and do so, because whenever you introduce noise in the ear, there's always a risk of some adverse effects. Very, very rare. To be honest, I think I've only had one patient in all my years who developed some temporary tinnitus, which subsided within less than 24 hours. But nonetheless, if we can avoid it, why not? Here, I can't avoid it because this patient's got this thin sheet of dead skin that's attached to the canal wall, and we can't scrape this off with a Jobson horn or an ear hook. You're going to cause more trauma to the layer of skin that's lining the ear canal. So we're just using the fine suction probe here, which is a smaller internal diameter, which means less suction power, but there's less noise as well, and less likelihood of clarinetting occurring. When you sometimes peel dead skin, as we are, the skin can violently flap at the tip of the suction probe, and it can emit a very loud, high-frequency squeal. It's not only deafening for the patient, but also for myself, the practitioner, and we're not, obviously, the suction probe's not in our ear. So a fine end works really, really well. There's going to be a bit of dead skin left over. We're not going to get every little aspect. It's just not humanly possible, but I removed as much as we could, safely as possible. There's a bit of skin here. I think this is quite a stubborn piece, but we shall see if it comes away. Their right ear is actually the worst out of the two. Now, the patient was originally prescribed a cream version of their medication, but it's also available in an ointment version, and I think their GP swapped them over to the ointment, but we both feel that the patient was faring a lot better when they had the cream version, and so we looked at the differences between the ointment and the cream version, and we found that the cream version is far better for moist, weepy skin, and this is what this patient develops. Their skin is naturally very macerated and moist, whereas the ointment is a lot thicker and greasier in consistency, as you can see here. But that's better for more dry, flaky skin. So you can get irritation in your ears. Your skin can be itchy because it's either very dry, or on the opposite spectrum, because it's very moist and macerated. So we've written to the patient's GP and just to see whether we can get this patient back on the cream version, because they did fare better with that. I've also recommended the patient to see if they can arrange a referral to see a dermatologist via their GP, because it is really getting them down this condition they've got in their ears. And it's just exclusive to their ears, no other part of the body. They don't suffer from eczema, psoriasis, or dermatitis anywhere else. It's just their ears. And it's the constant feeling for this patient of having to itch their ears. And of course, when you've got an itch and you scratch it, unfortunately, you're going to make it worse. It's a vicious cycle. I've also recommended that they, especially in the bedroom, use a dehumidifier. I've had patients in the past who suffer from really, really dry, itchy ears, or moist, itchy ears as well. And just by having a dehumidifier in the bedroom at night really, really helped. So this patient is due back actually in a couple of months, because it's every 6 months they attend, and the last attended in May. So I shall see how they fared. If I don't see them in 6 months, it means that they're doing well, and so that's a good sign as well. The patient sees a colleague of mine previously, an ENT consultant, but they do less private clinics now, so it's more difficult for the patient to book in, and my colleague kindly recommended that the patient come and see myself. It's a bit of a journey, but it's manageable twice a year. So, and the patient appears very, very happy. They've been there several times now, which is great. So it shows that we're doing something right. So remove the occlusion from the right ear, and it's just this layer of skin. You can see the skin underneath. It's very tender, slightly inflamed. So we want to be careful. When you've got inflamed, tender skin, it's more susceptible to trauma. So if we were to really abrase the ear canal and scratch it, it can make matters far, far worse. So I'm just hovering over, trying to gently peel this away. So this remaining layer of skin itself can cause a bit of itchiness. For other patients, we'll probably just leave it. But this patient's primary symptom is psoriatis, so itchiness in their ears. So I want to try and remove this if possible. I think we get most of it away. And I'm just trying to search for a part of the skin that I can lift up and away, and you can see we've got it here. And I think this comes off in a long tail, which is C. So it extends all the way to the eardrum there. The medial aspect of the canal looks far healthier than the lateral, so it's more the cartilage portion this patient's got this itchiness and weepy, moist skin. It's just on the front part of the ear canal, just trying to gently peel that away. I don't think this comes away, we shall see. Oh, so actually a lot of it did. I'm just suctioning it backwards. I'm doing a back peel. When you're peeling skin, sometimes you can peel the skin towards the eardrum, but sometimes that's not very beneficial. So you try it the other way, you peel skin towards the entrance, and it works better. So, and that particular section of the ear, it was far more effective to trying to peel the skin back. So I'm just mopping up on the back section of the ear canal here. And this is where an endoscope is really good. We're able to visualize these regions of the ear, which I'd probably struggle with the WAXscope even, and a microscope or head loops. So the endoscope provides you with this unparalleled wide field of view. It's almost panoramic. And that's why it's a great instrument to remove earwax. Going back to the WAXscope, for one moment, I'm not saying the WAXscope is better than the endoscope. I don't believe it is. They're two different technologies. But problem with the endoscope is a lot of people really, really struggle to use it and are not able to pick up the technique that's required to safely use an endoscope. So for those people, they're then reverting to other visualization methods of removing earwax, which for me are very limited, other than an ENT microscope, but they weigh a ton. There's a lot of training involved and they're very, very expensive. So the WAXscope for me is the next best alternative, but also I would say you can use it in combination as well with the endoscope. Hi everyone, and I'm just going to be quiet now and let you watch the demonstration. I wanted to do a quick demonstration video of how the WAXscope is actually held during use, and also to show you how you can use the full range of different ENT micro instruments to remove earwax. So first of all, the grip differs from the traditional grip we teach people to use, the iClearScope. So it's a horizontal grip with the base of the smartphone on the top of your forearm near your wrist, and it's a very relaxed grip actually, as you can see, and because it's resting on the top of your wrist there, it really takes the weight off the procedure, so it is very user-friendly in that respects. So the speculum itself, you clip on and off, and you can see we've got an opening at the top to help with the insertion of the instrument, and that can be rotated. I have it slightly more at 2 o'clock being right-handed, so because my instrument, you'll see in a moment, is going to come through that direction. So in terms of the brace, you can see you've got a good safety brace there, and we can adjust the focus with a quick swipe, so that's out of focus. I don't know how well you can see it on there, and you can also adjust the exposure. You can have it brighter, or obviously a bit less in this case. Now inside the ear we've got an oto block, so if you're an audiologist or a hearing care practitioner, you'll know what one of these are, and I'm just going to demonstrate how this can be removed in different ways. Now we've also got a zoom feature, so we can get it out. So first of all, I'm going to use an ear hook. Now we have got our own range coming out shortly, but I'm going to see if I can do this because the camera is slightly in the way, but you can see how an ear hook can be used to go in and behind this oto block and slowly retrieve it. I'm going to push that back in, and this is quite deep in the ear. I'm now going to use a Jobson horn and do the same thing. And in and behind. I'm slowly bringing that forward. It's a bit more difficult removing an oto block using a Jobson horn, admittedly. So I'm just going to push that back in. And I'm just going to adjust the focus. We also going to try and introduce an autofocus, so you can just double tap the screen and it will automatically get things in focus for you. I'm now going to use some forceps. These are the large forceps actually, just to show you that they do fit very well. And you can see we can pinch and move that. And then finally, I'm going to use perform some microsuction. So I'm just going to switch that on. I'll be back in a moment. So we're just going to perform microsuction now, and you can see we're holding it from the handle. Got a nice focused view of the suction handle, the tip of the suction probe there. Again, it's very difficult to remove an oto block with a suction because of all the air gaps. Let's give it a little wriggle. And what's great is if we need to readjust the focus, because at any stage we've brought the wax filter back, it's just a simple swipe. We can zoom in at the top, get that focused, and I'll just revert back to the St. Arts ear hook here. You can see how we got that zoomed in, and I will try and move it on this occasion. Come out the ear, we're going to re-enter. I'm going to zoom back out, and we're going to get that eardrum to focus. There we go. Well, I hope you enjoyed that, and if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.